Do you ever felt a sharp, unrelenting pain or noticed something strange about your urine? It could be more than just a minor issue. In this video, we're uncovering the top 8 nighttime signs of kidney stones that you shouldn't ignore. From intense discomfort to alarming changes in your urine, these symptoms could signal something serious. Stay tuned to find out what they are and how you can take action before it's too late. Severe pain. Kidney stones often cause severe pain, known as renal colic. This pain usually begins suddenly when the stone moves into the ureter, the narrow tube connecting the kidney to the bladder. Pain is intense and can come in waves, often radiating from the side and back, below the ribs, and spreading to the lower abdomen and groin as the stone moves. It can be excruciating, and it is typically described as one of the worst pains imaginable, sometimes compared to childbirth or being stabbed. This pain can make it difficult to find a comfortable position, leading to constant movement and restlessness in an attempt to alleviate the discomfort. The severity of the pain can be so overwhelming that it often requires emergency medical attention. Pain management is a critical aspect of treatment, typically involving strong painkillers like opioids or non-steroidal anti-inflammatory drugs, NSAIDs. Understanding the nature of this severe pain and its triggers can help in seeking prompt medical care and implementing effective pain relief strategies. Pain during urination. Kidney stones can cause significant pain during urination, a condition known as dysuria. This pain occurs when a stone moves down the ureter and approaches the bladder, or when it passes into the urethra, tube through which urine exits the body. The stone's rough surface can irritate and scratch the delicate lining of the urinary tract, leading to sharp, burning pain that intensifies when passing urine. This discomfort can range from a mild, tingling sensation to severe, stabbing pain. Due to the stone impeding the urine flow, in certain circumstances, pain may be accompanied by a constant need to urinate, even when there isn't much urine to pass. The presence of stones in the urinary tract can also cause inflammation, further aggravating the pain. Pain during urination can be particularly distressing and disrupt daily activity. It is crucial to seek medical advice if this symptom occurs, as it could indicate the presence of a kidney stone or other urinary tract issues. Treatment often involves pain management, hydration to help pass the stone, and, in some cases, medical procedures to remove or break down the stone. Blood in urine. Blood in the urine, or hematuria, is a common sign of kidney stones. It occurs when stones, typically with rough, jagged surfaces, scrape the lining of the urinary tract as they move, causing bleeding. This bleeding can range from microscopic amounts, detectable only under a microscope, to visible amounts that turn the urine pink, red, or brown. Urinary tract pain and excruciating back or side pain are common symptoms that accompany the potentially dangerous presence of blood in the urine. Hematuria indicates that the stone is causing significant irritation or damage to the urinary tract. In some cases, blood in the urine may also be a sign of other underlying conditions, such as urinary tract infections, bladder or kidney infections, or even more severe conditions like cancer. Therefore, it's crucial to seek medical attention if you notice blood in your urine. Diagnosis typically involves a physical examination, urinalysis, imaging tests like CT scans or ultrasounds, and sometimes cystoscopy. Treatment may include pain management, increasing fluid intake to help pass the stone, and, if necessary, medical procedures to remove or break down the stone. Frequent urination. Frequent urination is a common symptom of kidney stone, often occurring as the stone moves through the urinary tract and irritates the bladder or urethra. This irritation can lead to a persistent urge to urinate, even if only a small amount of urine is present. The sensation of needing to urinate frequently can disrupt daily activities and affect sleep, causing considerable discomfort. Other signs, such as pain during urination, dysuria, and difficulty initiating or maintaining a steady urine stream, may accompany the increased frequency of urinating. This can be particularly frustrating and may lead to increased anxiety or distress. Frequent urination can indicate that the stone has moved into the lower urinary tract, nearing the bladder. Frequent urination can also result from the body's response to inflammation and irritation caused by the stone. It is essential to stay hydrated to help flush out the stone, but managing this symptom can be challenging. A medical evaluation is crucial for determining the underlying cause, frequent urination. Treatment typically involves pain relief, increased fluid intake, and sometimes medications or procedures to help pass or remove the stone. Identifying and treating the root cause of frequent urination can significantly improve comfort and quality of life. Cloudy or foul-smelling urine. Cloudy or foul-smelling urine is a common symptom associated with kidney stones. This change in urine appearance and odor occurs due to various factors, including infection, high levels of certain minerals, or the presence of pus and white blood cells pyuria. When kidney stones obstruct the urinary tract, they can create an environment conducive to bacterial growth, leading to urinary tract infections, UTIs. The bacteria produce waste products that can make the urine appear cloudy and emit a strong, unpleasant odor. The stone itself can cause the release of substances that alter the urine's clarity and smell. The presence of cloudy or foul-smelling urine often accompanies other symptoms such as pain during urination, frequent urination, and severe pain in the back or side. It can be an indication of a more serious condition, such as a kidney infection, pyelonephritis, which requires prompt medical attention. Diagnosis typically involves a urinalysis to detect infection, blood, or other abnormalities in the urine, along with imaging tests to locate the stone. Treatment includes antibiotics for any infection, increased fluid intake to help pass the stone, and potentially medical procedures to remove or break down the stone. Recognizing and addressing these symptoms early and prevent complications and promote better urinary health. Nausea and vomiting. Nausea and vomiting are common symptoms associated with kidney stones. These symptoms occur due to the body's reaction to severe pain and the disruption of normal kidney function. The intense pain from kidney stones, often referred to as renal colic, can stimulate the nerves connecting the kidneys and the gastrointestinal (GI) tract, leading to nausea and vomiting. When a kidney stone obstructs the urinary tract, it can cause significant discomfort and stress, triggering a systemic response that affects the GI system. The body may experience feelings of nausea, along with real vomiting, as a way of coping with the pain and stress. The body is responding to the obstruction and irritation in the urinary system by trying to reduce the discomfort. Nausea and vomiting can also result from the buildup of waste products in the blood due to reduced kidney function, as the kidneys are responsible for filtering and excreting these wastes. The kidney stone blocks the flow of urine, toxins can accumulate, leading to gastrointestinal symptoms. Treatment for nausea and vomiting caused by kidney stones typically involves pain management, hydration, and sometimes anti-nausea medications. Addressing the underlying cause, such as passing the stone or removing it through medical procedures, is crucial for relieving these symptoms and restoring normal kidney function. Fever and chills. Fever and chills can occur as a complication of kidney stones, particularly if they lead to a urinary tract infection, UTI, or a kidney infection, pyelonephritis. When a kidney stone obstructs the flow of urine, it can create an environment where bacteria thrive, leading to infection. The body responds to this infection by raising its temperature, resulting in fever. Kidney stone fever usually has a high fever with chills as the body tries to normalize its temperature. Chills occur as the body experiences rapid muscle contractions in response to the fever, trying to generate heat and reach a normal temperature. Fever and chills often signal a more serious condition, requiring immediate medical attention. Alongside these symptoms, patients might experience severe pain, nausea, and vomiting. Diagnosis involves blood tests to detect infection and imaging studies to locate the stone. Treatment typically includes antibiotics to address the infection and procedures to remove or break down the stone. Prompt treatment is crucial to prevent complications and ensure recovery. Unable to urinate. The inability to urinate, or urinary retention, can occur when a kidney stone obstructs the flow of urine from the bladder or urethra. This blockage can be partial or complete, leading to difficulty starting urination or an inability to pass urine at all. When a stone lodges in the urethra or at the bladder outlet, it creates a physical barrier that prevents urine from leaving the body. This condition can cause extreme discomfort, a swollen bladder, and intense pressure in the lower abdomen. In severe cases, the bladder may become distended, which can lead to pain and potential damage if left untreated. Other symptoms that may accompany urinary retention include pain, discomfort, and incessant urge to urinate. In severe instances, it can lead to kidney damage or infection if the urine backs up into the kidneys. Diagnosis involves a physical examination, ultrasound, or other imaging tests to locate the stone and assess the level of obstruction. Treatment may include catheterization to relieve pressure, medications to ease symptoms, or surgical procedures to remove or break down the stone. Immediate medical intervention is crucial to relieve symptoms and prevent complications.